FiO2 on the ventilator, what does it actually mean? It stands for fraction of inspired oxygen, representing the concentration of oxygen a patient breathes. While the room air we breathe is only 21% oxygen, patients in respiratory distress often require a much higher concentration to maintain life.
On a ventilator, FiO2 can be increased from 21% all the way up to 100% to support the patient. This adjustment allows more oxygen to move from the lungs into the bloodstream to improve overall saturation. It is the primary tool used to manage hypoxia and improve arterial oxygen levels during critical care.
However, more oxygen isn't always better for the patient. A key nursing goal is to use the lowest FiO2 possible that still maintains adequate oxygen saturation to avoid the risks of oxygen toxicity. Always monitor your patient closely and titrate settings wisely to protect lung tissue while ensuring stability.